When going to the hospital, it can seem as though there are an endless number of people you encounter. There are nurses, doctors, respiratory therapists, nursing assistants, food service workers, maintenance, and housekeeping, just to name a few. Keeping track of everyone can be a daunting task. Join me this week as I explain who some of the main players are at the hospital and what some of their responsibilities may include. The nursing staff is one of the central arteries to patient care at hospitals. They have vast duties and can make a hospital stay a good or bad experience. Here are some of the key figures to know. 1 to 2 nurses will be assigned to your room for each shift. In general, your nurse will be responsible for administering your medications, connecting, disconnecting, and monitoring your IV solutions, completing a general health assessment at the beginning of each shift, and coordinating care with your medical team. In general, if you have any medical needs, your nurse is the person to contact. On each unit, there will be one nurse designated as the charge nurse. This nurse is responsible for all the nurses in the unit. The charge nurse will often be a caregiver to patients. However, many times the charge nurse's patients will also be covered by another nurse, since the charge nurse may be called away to attend to other business. If you have an issue with your nurse, you can always contact the charge nurse to bring attention to your grievance. Most of the time, the charge nurse can act as an intermediary and resolve any disputes which may have arisen between you and your nurse. Nursing assistants help the nurses with basic care needs. The nursing assistant will most likely be the one rounding every few hours to check your vital signs. Nursing assistants can help you to the bathroom and may change your bed linens and assist you as you bathe. Nursing assistants cannot administer medication and do not coordinate your care with your medical team. In general, nursing assistants help with all non-medical needs. If you are not sure if your need is medical or not, ask the nursing assistant for help. If the nursing assistant cannot help you, your concern will be passed along to your nurse. Your medical team will consist of a general practitioner and possibly specialists. The general practitioner may be a hospitalist, family medicine, internal medicine, or pediatrics physician. Specialists may include pulmonology, cardiology, neurology, infectious disease, etc. If you're being hospitalized for a simple, non-complicated reason, you may only have the general practitioner as your medical team. If your case is more complicated, such as pneumonia, you may have a general practitioner, pulmonologist, and infectious disease specialists as your medical team. On each medical team, there will be an attending doctor, and there may be several additional doctors or doctors in training. There may be fellows, residents, and/or medical students. Attendings are the leaders of the medical team. They have completed medical school, completed a residency program, and potentially have completed additional training called a fellowship. The attending has the ability to prescribe medication and will consider all the information available to create a care plan. The attending has the ultimate say in what tests are ordered, what medications you receive, and when you will be released home. One step below the attending doctor are fellows. Fellows have graduated medical school and have completed a residency program. A fellow is part of a fellowship training program, which is an additional educational program to train the doctor in a specific area. Fellowship programs are 1 to 3 years long in length, depending on the specialty the doctor is pursuing. The fellow is well versed in medicine and will have a good knowledge of medical conditions and medicines to use. In general, I find the fellows to be similar in nature to the attending doctor. There is often very little difference between the two. The fellow and the attending often have the same ideas for a treatment plan. Many times, the attending doctor will rely on the fellow to make decisions and guide the care plan. Resident doctors are doctors who have graduated medical school and are in a training program called residency. Residency training programs can vary from 3 to 7 years in length, depending on the specialty. For a general medicine program, such as family medicine, internal medicine, and pediatrics, the residency program is often 3 years in length. More complicated specialties, such as surgery, may last from 5 to 7 years. Resident doctors have a very basic knowledge of medicine. In general, I find resident doctors very naive and green in regards to prescribing medication and knowledge about medical conditions. Resident doctors will often come to your room early in the morning to ask you questions about your health and will give you a brief update about your case. They will often take the information they gleaned from your interview and relay this message back to the attending and/or the fellow. Resident doctors have limited ability to prescribe medication. Some medicine they are not able to prescribe and will need the fellow or attending doctor to sign off on the prescription. Resident doctors can make suggestions for your care. In general, the attending doctor must agree to the care plan before the resident is able to execute his wishes. Words of advice. Some medical centers are very short on staff. Resident doctors are sometimes given a lot of power. The fellow or attending doctor will sign off on almost anything the resident doctor asks for. This can be very dangerous. This may cause bad outcomes and may cause errors in your medical case. If you feel your case is not being handled correctly, talk to your charge nurse and express your concerns. The charge nurse may be able to intervene and help get your medical case back on track. In some residency programs, there is a chief resident position. This position may be the final year of the doctor's residency program, or a resident may be selected during her final year of residency to fill this position. The resident then will attend one additional year of residency. Since the chief resident is at the end of her residency program, she is usually very knowledgeable and has a good deal of experience in the medical field. I often find chief residents are extremely motivated and very effective at getting things done in a timely manner. The lowest player on your medical team are medical students. Some hospitals have medical students, while others do not. In general, the medical student is usually linked up with another medical student, a resident, or a fellow. Medical students rarely show up in your room all alone. Medical students are not doctors. They are doctors in training. They do not have the ability to prescribe medicine. They have little power in determining your treatment plan. They may give suggestions to your medical team, but often their input must be confirmed by a resident, fellow, or the attending doctor. To summarize all the different levels of doctors and doctors in training, this chart highlights the key differences. Attending doctors are the lead doctor. They have graduated medical school, completed a residency program, have the ability to prescribe drugs, and have vast medical knowledge and experience. Fellows are doctors who have graduated medical school, completed a residency program, have the ability to prescribe medicine, and have a broad and in-depth knowledge about medicine. Resident doctors are doctors who have graduated medical school, but are still in a residency training program. They have limited abilities to prescribe medicine and have limited medical experience and knowledge. Medical students are still in school. They are not doctors. They cannot prescribe medicine and have extremely limited medical experience. Some medical teams will introduce themselves and tell you who is a resident, fellow, attending, or medical student. If this does not happen, you can usually look on the hospital ID badge for information about the person standing before you. Medical students will have student written on their ID badge. Residents will either have resident or an R on their name badge. Fellows may have fellow written on their badge, or they may have no designation and will just simply have on their ID badge the doctor's name and specialty. Attending doctors often have plain badges and will just state the doctor's name and specialty. Respiratory therapists are healthcare practitioners who have graduated a respiratory therapy program. They will assess a patient's breathing status. If you have a ventilator, the respiratory therapist will manage your ventilator while hospitalized. Respiratory therapists have the ability to administer drugs through a nebulizer. These drugs are usually ordered by your physician. However, most hospitals also have standing orders in place in which a respiratory therapist can administer standard medications based on the patient's breathing needs. For example, if a patient is having an asthma attack, the respiratory therapist can administer albuterol through the nebulizer without needing to contact a physician to get an order for the medicine. Respiratory therapists are a great asset. They can order any tracheostomy or ventilator supplies you may need while hospitalized. They can suction your airways and care for your tracheostomy tube. Additionally, they can help direct your treatment plan. Many doctors often rely on respiratory therapists to help assess the patient's breathing needs. While hospitalized, you may or may not encounter an occupational or physical therapist. An occupational therapist is concerned with restoring a patient's ability to perform daily tasks. A physical therapist is focused on mobilizing a patient and helping a patient gain strength. I like to think of an occupational therapist as the person who helps you figure out how to hold a fork so you can eat. A physical therapist is the person who helps you gain strength to move your arm up and down to be able to propel your wheelchair. In almost every department, there is a potential for having a student shadow an employee. Students will almost always be introduced with their fully certified counterpart. The student may only observe the employee, or the student may perform all the tasks while being supervised by the employee. In general, the student will almost always be very nervous and very clumsy as he attempts to assist you. Be patient and try not to talk too much to the student as he's attempting the tasks. It is easy to get distracted by conversation, and you will want the student to direct as much attention as he can to the task at hand. An important person who will be part of your medical team is called a case manager. This is a nurse who is in charge of your discharge planning. If you have any medical needs, such as you use a ventilator or you utilize a wheelchair, you will be contacted by the case manager prior to discharge. The case manager will review your living accommodations and your medical equipment needs to ensure you are ready to transition from the hospital back to your home. The case manager is also the person in charge of getting home health and infusion medication set up. If the case manager does not feel you are ready for discharge, or if she cannot get everything you need arranged for discharge, you will not be allowed to be released home. Maintenance and housekeeping staff work to keep the hospital clean and in good order. Maintenance workers usually do not enter your room unless there is something in your room which needs to be fixed. They usually work fast and do not often talk to you. Housekeeping is another vital asset to the hospital. They clean up disgusting messes and ensure patient rooms are sanitized. A housekeeper may enter your room once a day to do a quick cleaning of your room. On holidays and weekends, housekeeping usually does not come in to clean your room. Food service is the department in charge of preparing and delivering meals. Food service has a daunting task to prepare and deliver a mass quantity of meals in a very short time frame. When your meal is delivered to your room, quickly check your tray to make sure it is your food tray. Sometimes I have received someone else's food. It is much easier to catch the mistake while the food service worker is still in your room than have to call and get everything sorted out once the worker has left. There are a number of other people you may encounter in the hospital, such as social workers, medical records, the billing department, registration, transport, etc. For brevity's sake, I will not review the role of each of these departments. Just remember to be nice to the person assisting you and ask questions if you have any concerns. I hope this has given you a good understanding of some of the main players at the hospital. I hope none of us have to be hospitalized, but in the event we are, remember, be kind to everyone you encounter. A smile and patience can go a long ways in help creating a good hospital experience. Thank you so much for joining me. Please remember to like and subscribe down below. I hope you have a great day and a wonderful week. Bye-bye.